Today's topic is cardiac cycle. So cardiac cycle. So we will be discussing first what is cardiac cycle. Cardiac cycle is a mechanical event which is happening in the heart during one systole and one diastole. So it's coordinated events taking place in the heart during each cycle, cardiac cycle, right? So it has a two, as we already know, it has a systole and diastole. One systole and one diastole is, we call it as cardiac cycle, right? So we are going to discuss what are the things happening during one systole and one diastole, mechanical events during one systole and diastole. You know what is systole, what is diastole? Systole means contraction and it ejects the pump. Diastole is relaxation and it receives the blood, right? Ejects the blood and receives the blood. Okay. So the cardiac cycle or the cardiac, it's divided into atrial events and ventricular events. I think we discussed brief about these things last class. So atrial events and ventricular events. You know, when the heart, and if the heart is beating at normal pace 72 per minute, then in 1 minute, if it is beating for 72 times, then cardiac cycle duration is 0.8 seconds, right? And what are the atrial events? See, the cardiac diastole and systole and diastole we can discuss in two ways. That is atrial systole and atrial diastole. When atrium is contracting, we call atrial systole, and atrium is relaxing, we call atrial diastole. At the same time, ventricle is contracting and ventricle is relaxing. We call it as ventricular systole and ventricular diastole. Or in other words, when atrium is contracting, ventricle is, during atrial systole, ventricular diastole hota hai, and during atrial diastole, ventricular systole. So systole and diastole, it happens both in atrium and ventricle. So what we discussed in the definition, systole means cardiac cycle means one systole and one diastole. Which systole and which diastole? Question is ventricular systole. So in the in cardiac system, systole means atrial systole. Systole means ventricular systole and diastole means ventricular diastole. So we are not discussing about atrial systole and atrial diastole. Yes, atrial systole is happening, but we are going to discuss ventricular systole and ventricular diastole. So if we are discussing atrial systole, the duration of, we know that 0.8 is the one cardiac cycle. So if we take atrial systole and atrial diastole separately, the duration is, atrial systole is 0.1 second, total is 0.8, right? Atrium is contracting for only 0.1 seconds and atrium is relaxing for 0.7 seconds, right? And when you talk about ventricular systole, right, that we already know, 0.3 and 0.5. Ventricular systole is 0.27, approximately 0.3 seconds. Ventricle is contracting for 0.3 seconds and ventricle is relaxing for 0.5 seconds, right? So now, in clinical practice, the term systole, as we already discussed, systole means ventricular systole and diastole means ventricular diastole. So we are going to study only this portion, 0.3 seconds and 0.5 seconds. So we are going to discuss what are the mechanical events occurring during one ventricular systole and one ventricular diastole. So this is what we are going to discuss. Atrial systole and atrial diastole, yes, it is happening during ventricular systole, ventricular diastole, but we are going to concentrate on ventricular systole, ventricular diastole. Okay. So now, this I will explain. I will just show the diagram. This is the, see, ventricular, this is the duration of ventricular systole and outer circle, right? And this is the duration of ventricular diastole. that is 0.3 seconds, right? And if you include this, it will become 0.5 seconds, right? Outer ring, ventricular systole, ventricular diastole. And this also, this whole circle, inner circle also represent 0.8 seconds. But when you talk about duration, atrial systole is very small, that is 0.1 second, and atrial diastole is 0.7 second. Are you getting? Total is 0.8 second, right? If you talk atrial systole, atrial diastole, 0.1 and 0.7. If you are discussing ventricular systole, ventricular diastole, 0.3 and 0.5 second. So there is an overlap between ventricular systole and 0.8 second is same for both, right? But there is an overlap. So that overlap is shown here, right? So if you carefully watch this diagram, see this diagram. See what is this outer ring from here to here? It is ventricular diastole. That is ventricle is relaxing, or ventricles are receiving the blood. During this phase, see atrial systole is included, right? Atrial systole is included during ventricular diastole. There is an overlap of ventricular diastole and atrial systole. So we are going to discuss cardiac cycle from atrial systole. From this phase we are going to start, right? Okay. So now coming to atrial systole. So atrial systole, that is atrial contraction. We are going to discuss what are the things happening during atrial systole. So cardiac cycle is equal to 1 systole and 1 diastole, right? Okay. So first we are going to discuss atrial systole, right? So during atrial systole, that is atrial systole means that atrial is now contracting. So we are going to discuss cardiac cycle from atrial systole, which is the last part of the ventricular diastole, right? So during atrial systole, the aortic valve it remains closed, right? And when atrium is contracting, the valve should open. What is this valve? Mitral valve. Mitral valve is open, and we already discussed last class. When atrium is contracting, 80% of the blood is already filled in the ventricle. That is, 80% of the blood is filled in the ventricle before onset of atrial systole. That is, when atrium is contracting, right, only 20% of the blood is pushed from the atrium to ventricle. That is, last filling of the ventricle is happening because of atrial contraction. So 20% of the blood is filled during atrial contraction. So during atrial contraction, we are going to discuss 3 points. Atrial contraction, you will be discussing what is happening in atrium and what is happening in ventricle. At the time of atrial contraction, we are going to discuss what are the changes occurring in atrium, what are the changes occurring in ventricle, and what are the changes occurring in aorta. 3 things we are going to discuss simultaneously, right? And third is what is happening in aorta. In atrial, okay, already we discussed 80% of the blood is filled, right? When a atrium is contracting, what is this valve called? Mitral valve. Mitral valve is open, right? Mitral valve is open, or in other words, for atrium, input valve is open and output valve is closed. During atrial systole, right, the input valve for the atrium is open and exit valve is closed. That is, aortic valve is closed and mitral valve is open, right? And 20% of the blood is added to the ventricle, right? And when atrium is contracting, 20% is now filled, right? And when atrium is contracting, the pressure inside the atrium will slightly increase because atrium is contracting, right? So the pressure will slightly increase. So this wave is called as pressure wave, and the wave is called as which wave? A wave. This wave is called A wave. The pressure in the ventricle atrium slightly increases because of contraction. And what is the pressure here in the ventricle? It will be 0 because it is relaxing, right? Pressure in the ventricle will be 0. And because the mitral valve is open, the pressure generated in the atrium will also reach the ventricle. So the pressure slightly it goes up from 0 to 4, 3 or 4, right? Because of this A wave, valve is open. Whenever there is a pressure change in the atrium, in the ventricle also the pressure slightly increases. And this pressure is pressure A, pressure wave A, right? And now, what happens to ventricle? Atrium we discussed and ventricle we discussed. What is happening in the aorta? What is happening in the aorta? Here which valve is closed? Aortic valve is closed. So what will be the pressure here? We already discussed. During ventricular diastole, pressure in the aorta will be 80. So the pressure, it is having the blood, right? It is already having blood of previous ejection, and valve is closed and the blood is moving periphery and pressure is 80. Are you clear? During atrial systole, you are discussing 3 points. What is happening in atrium? In atrium, pressure is slightly increased and mitral valve is open, right? Aortic valve is closed. Already 80% is filled, so 20% of the blood is pushed, right? That is active phase, active contraction. Passive, 80% is filled by passively 80%, only 20% of the blood is filled because of atrial contraction, right? And then here it is 80%, 80 millimeter of mercury. Pressure in the aorta is 80 millimeter of mercury because the valve is closed, right? And next phase. So what is happening next? So when ventricle is so now the blood is completely filled, 100% blood is filled in the ventricle. Now what happens? Onset of ventricular systole. Onset. After atrial contraction, when atrial contraction completes, what should happen? Ventricular contraction, systole should happen. That is onset of, during onset of ventricular contraction. So we are going to study next phase, onset of ventricular contraction. So here what happens, what we discussed already, the pressure is 0 in ventricle. Previously the pressure was 0 and it is slightly increased to 4 because of the A wave, right? Now already it is having minimum, that is 4 millimeter of mercury pressure, approximately 4. Now what is happening? The ventricle is contracting. And what happened? What about this valve? This is already closed. Aortic valve is already closed. And the pressure is slightly, because ventricles are contracting slightly, the pressure will increase to 5 millimeter of mercury. So what will happen when the pressure is slightly building up in the ventricle? Suddenly this valve will close. Right? During onset of ventricular contraction, when the pressure reach approximately 5 millimeter of mercury in ventricle, that is onset of ventricular contraction, this valve will close, right? And this, when this valve is closing, what sound you will hear? Heart sound. First heart sound you will hear. First heart sound. It is S1 sound, right? And already we discussed. What we are discussing, this is left atrium and left ventricle. We are studying only left atrium and left ventricle. Whatever events occurring in the left side of the heart, same event will occur in the right side of the heart, but with slightly different pressure. Pressure will not be same on the right heart and left heart. Pressure will be different, right? So in the left side, the right side also, the valve, atrioventricular valve is closing, right? When ventricles are contracting, right, this valve is getting closed. Left atrioventricular valve is getting closed. At the same time, right atrioventricular valve will also close. Are you clear what I am saying? So this both valve will close at the same time, right? And you are getting heart sound, first heart sound, that is S1, right? Already I have told you, when you will hear the sound when the valve is closing. The sound which you hear is closing of the valve. When the valve is opening, you will not get any sound, right? When the valve is closing, you will get sound, right? And both the valve, right valve and left valve, are closing at exactly same time. But that's why you are hearing only one sound, right? Both the right atrioventricular valve, left atrioventricular valve are closed at the same time. So what will happen? Sound you will hear lub. That lub is because of two reasons. Closing of right valve and left valve at the same time. That's why you are hearing only single heart sound, right? S1. Okay. So now, when the pressure is increased to 5, right? When the pressure is increased to 5, okay. Valve closes and this valve is still closed. The valve is still closed and here it is just now closed. And further the atrium is contracting, right? Sorry, ventricles are contracting, still it is contracting. So now the ventricle is contracting as a closed chamber, right? Why? Because this valve, input valve is also closed and output valve is also closed. And what happened? The heart, now the ventricles are contracting. So now it is contracting as a closed, like a closed chamber, right? And it is called isovolumetric phase. What is isovolumetric phase? See, the blood is also blood volume is also not changed in this phase. Blood volume is not changed. Why? Because both the valves are closed, right? But at the same time, and there is increasing in the pressure. Gradually pressure is increasing in the ventricle, right? So the pressure is changed, the size of the ventricle ventricle is also remain same, and the blood volume is also not increasing. At the same time pressure is increased in the ventricle. So that is why it is called isovolumetric phase. There is no change in the size of the ventricle and there is no change in the blood volume, right? Okay, so what is happening? So what is the second phase we are discussing? Onset of ventricular systole. So what happens? What happened in atrium? What happened in ventricle? And what happened in the aorta at this phase? So what is happening in atrium? When ventricle is contracting, we are discussing what is happening in atrium. Simultaneously we are going to study this and this chamber and this chamber. Okay. So what happens here? Already which wave is there? A wave is there already. That is because of atrial systole. We discussed already. And when the pressure has reached 0 to 5, right? What happens? The valve is closed. Right? The valve is closed. Which valve? Left atrioventricular valve is closed. When the valve is closed, slightly the pressure is increased in the atrium because the valve is closed due to back pressure. Right? The pressure is slightly increased in the atrium during onset of ventricle. We are discussing second phase. So this is A wave, that is pressure wave, and this is C wave, right? And this C wave is because of closure of the valve, right? And what is happening here? Ventricle we have discussed, 80% blood and 20%, it is having 100% blood, 20% is already filled, and pressure is increasing 0 to 4 to 5, and gradually the pressure is building up and it will increase 50, 60, right? Gradually, because it is now contracting gradually, right? And what happens here? Still the valve is closed. Why it is closed? Why it is closed? Why it is closed? Because pressure is still higher than the ventricular pressure. Aortic pressure is still higher. See, here it is 60 only, right? And here it is 80. So if pressure is not more to open the valve, so that is why still it is closed. And what is happening? The blood is still moving to the periphery. What happened here? Valve is closed, and here also the valve is closed. We are discussing third phase, rapid ejection phase. Rapid ejection phase. So again we will recap. So here how much blood is now here present? 100% of the blood is, it is totally filled, right? And the pressure is, what is this pressure? What is this wave? A wave. It is because of atrial systole. And what is this wave? C wave. Because of, when the pressure has reached 0 to 5, it has closed. Right? And what is the pressure here? 80 mm Hg. So here from 0 to 5, and now still it is contracting. Ventricle is now contracting. Right? Pressure is increasing 60, 70, 80. Right? Now we are discussing third phase, ventricular ejection phase. Now when the pressure, and still this is closed and this is also closed. When both the valves are closed, then this phase is called isovolumetric phase, right? Because input valve and output valve are closed and ventricles are contracting. Blood is not ejecting, right? So till that phase, it is called isovolumetric phase, right? When the pressure is increased 81, right? Suddenly the valve will open. Now this valve will so what is this valve? Aortic valve will suddenly it will open. So now which sound you will hear? Just now I have told you will not get any sound when valve is opening. You will hear only when valve is closed. So normally the aortic valve open silently. You will not hear any sound when the valve is opening. So when the pressure has reached 81, suddenly the valve is open. And what happens when the valve is open? The blood is forcefully ejected. And what will happen if the blood is forcefully ejected? The aorta will stretch out. Right? Aorta will stretch. Why it is stretching? Because it is ejecting the blood forcefully. Right? And still the ventricle is contracting. Still the ventricular contraction is continuing. Right? So what happened? When the pressure is 81, it is open, and pressure is still, it is building up. Right? So it will reach 85. This is the pressure when the valve is closed, and this is the pressure when this valve is open, right? And still the pressure is increasing 100, 110, 120. So maximum pressure generated in the ventricle is 120, right? And still the valve is open and the blood is getting ejected in the aorta, right? So now in this phase, what are the three things we are going to discuss? What is happening in atrium, what is happening in ventricle, and what is happening in aorta during rapid ejection phase. So in atrium, what is happening? Beginning, what happened? A wave because of atrial systole, and C wave, closure of which valve? Left atrioventricular valve. And now what is happening during this phase? It is receiving the blood from the lungs. Actually, left atrium is continuously receiving blood. It does not stop receiving blood, right? Even in first phase also it is receiving, second phase also receiving, third phase also it is receiving the blood. Continuously it is receiving all the time, right? So what happened? Here the blood is now collected. Here valve is closed already, right? When the pressure was 5, it is already closed. Now the blood is collecting in the atrium continuously, right? So now it is acting as a reservoir. It is acting as a tank and receiving blood from both the lungs, right and left lungs. Because the blood is increasing gradually, the pressure in the atrium will also gradually increase. because it is receiving blood, right? So the pressure will gradually increase in the atrium. This wave is called as V wave, right? V wave. A is atrial systole, C is contraction of closure of wall, which is S1 sound. So this is the point you will get sound, S1 sound, right? There is a graph you can see in the physiology book. You correlate with all the waves and graphs, right? Okay. And this rest of the wave is because of the ventricle is receiving blood from the lungs, so you will have the wave V wave. So this is happening in the atrium, right? And what is happening in the ventricle? We already discussed. From 81, so this we are discussing. When 81, valve is open and the blood is forcefully ejected, right? Are you clear? Because ventricle is continuing the ventricular contraction. Previously we discussed the onset of ventricular contraction. Previous phase is onset of ventricular contraction. Now ventricular contraction is still continuing, right? Okay, the pressure has increased 120. Now the pressure inside is 120. Now listen, because the valve is open, the pressure generated in the ventricle will be same in the aorta. The pressure, here also the pressure will be 120 because that pressure is transferred from the ventricle and valve is open. So whatever pressure changes occurred in the ventricle will reflect in the aorta. So now, and the aorta is stretched, right? And here also the pressure will be 120. So this is about third phase. So we have discussed the three phase today. One is atrial systole, isovolumetric phase and rapid ejection phase. So three phases we have discussed today.